compatriots, the Armenian Unified Info Center continues its work. First of all, situation on the front line. Today, during the whole day, the adversary, along the entire line of contact, continued its offensives in different directions. It was active both in the northern and in central and southern directions. And in the central direction, as the spokesperson of the Artsakh president said, the offensives were geared towards the civilians, the civil settlements, and very different subversive groups were enacted in the direction of small settlements and small knobs or hubs of the roads, and in the south, in different points, in focal points, different various units of the adversary continued their offensives both to the western, to northwestern part. In some places their aggression was suppressed and in some places thrown back, and significant losses were caused to them in some cases with lots of armory losses. And in this case, we had, as previously also, less active armored equipment. We had artillery and rocket forces, and as we already announced, another one, a Bayraktar type rocket was downed today, and the rest will be covered during our Q&A session. And today, taking the chance of this on-air time, I want to give the word to the Armenian MOH National Center for Disease Control and Prevention, doctor-epidemiologist Lusine Paronyan. Dear compatriots, all of you may know that we have increasingly high cases of COVID-19 cases, and each day we have significant increase over the previous day. This is the responsibility of all of us, and this is the result of our behavior, all of us. And the healthcare system very soon may find itself in a critical situation. It may collapse. You know, we are trying to reorganize hospitals. Today we have something like 2,000 patients who are being treated in hospitals, but there are very many COVID-19 positive patients who are waiting to be taken to the hospitals. And well, we are trying to wait for a situation, a more or less acceptable situation with the patient, so that we release, dismiss from the hospital and receive the others one. And now, of course, we understand that COVID-19 has been pushed to the background somehow because of this dramatic situation of the country, of the war. And we have come to this gruesome situation, and unfortunately we see unprecedented growth of the numbers of patients with COVID. And we should think about the resources of our healthcare system, and they should be put in the first place to service our service people, and we should try our best to minimize the numbers of COVID-19. And all these months, all these experiences that we had when we had the mandatory requirement of social distancing, wearing masks and washing hands, sanitizing your hands as often as possible, we did have reduction of the number of cases, COVID-19 cases, and so somehow we seemingly became more relaxed. But then, related to this military situation, to this war situation, we ended up with some 10 times more figures, statistics than we had before that. I just call on you not to forget about these threats, to abide by the rules, and I want to address specifically to our youngsters. Dear youngsters, the generation of independence, we're so proud of you. We know that you are much more informed, much more flexible. You yourselves could set an example for others by being responsible, not only by wearing the masks, but also demanding that the others too are wearing those. And just having the masks hanging on your arm or just below your chin is not wearing a mask. Well, of course, the youngsters may not have any symptoms of COVID-19 and may not feel or realize that they are sick or they do have COVID-19, but they may be well passing on this infection, the virus, to the elderly, to other members of the family, and then we may end up with an unpredictable situation. Let's not forget about our front line. We should be strong. We should have a very healthy rear so that we are able to secure the health of our servicemen. There is a question to me. So, there is a significant growth of COVID-19, and at the same time, very many volunteers go to fight in the front line. So, what are the measures taken in the front line or before that to prevent the spread of that? Perhaps there could be some preventive measures. Well, you know that in case of each COVID-19 positive case, we are doing analysis, and the relevant persons are isolated, and they are recorded in our med system, and then the information goes to the Ministry of Health about those who have contacted patients and the patients themselves, so that we're able to prevent the further spread of the disease. Well, of course, it is not always known to us who and when leaves for the front line, and that is why it is not very feasible to organize the tests, the examinations, and we are collaborating with our colleagues from the Ministry of Defense to be more aware of that, and even more so, we should remember that we should have healthy militia, and we should be able to minimize the contacts of those who are suspected to have contacted the patients with COVID-19, so that we reduce the possible spread of the disease. And once again, social distancing, mandatory mask wearing and washing hands, sanitizing your hands are as actual as always. And also, whether the Ministry of Health and your service, do you have triage possibilities? Yes, of course we have. We have a triage center in Grigor Lusavoric hospital, medical center, and on behalf of all the medical staff, when they see the situation of the patient and also the accompanying chronic diseases, they decide how to proceed with the treatment of those and what is the succession of that. Well, thank you, Ms. Antonian, and now let's attend to our questions. We have questions. Armen Press. What is the situation in the section of our border of Artsakh and Iranian? And the Azerbaijani side always says that they fully control this section of the border front line. Well, along the entire line that you mentioned, there are very fierce battles, and even if the Azerbaijani side see parts of River Arax, it doesn't mean that they control that section. Other question. Today, Russian President Putin said that the Azerbaijani and Armenian sides have each one about 2,000 killed in action or casualties, and so it is about 5,000 altogether. And we know that we have something like 800, as we have heard from our officials. But well, it is quite understandable that it is very generalized figure, and it is quite obvious that the adversary has many times more killed in action that we have. It is not like that, as you said. So it seems we do not have any other questions. Dear compatriots, different subversive groups of Azerbaijan, as I always said, and I said number of times, they tried to infiltrate into some settlements. They sometimes succeed to find themselves in a specific location to make selfies, to try to spread information that they are controlling those locations. And I call on you not to succumb to that, to be organized. These groups, as a rule, are very small, and after one very literate or surgical pinpoint attack, they flee and never, or at least for a long time, they do not come back. And very good examples are Drut and Fizuli towns. And this same pattern is used by Azeris in different areas covered by forests, with small groups that try to infiltrate. And in these situations, it is very easy to neutralize them. It seems to a new question has appeared. Well, Iranian border related. Well, I seem to have answered this one, and this question repeats. So this much: follow us. The Armenian Unified Info Center platforms are for that. Thank you.